All right, welcome back. In case you're just joining us, it's Nigeria's #1 financial news from The Money Show. Today on the program, we'll be looking at different health concerns. Of course, there have been outbreaks, disease outbreaks in recent times. Ebola, SARS, which one can I remember? Zika virus now. Lassa fever here in Nigeria. Joining me right now, my guest, I'll start the introduction from my immediate left. He's Dr. Ihua. He's the Chief Executive Officer at NOIPolls. He was here on Wednesday. Welcome again to the program.
Thank you, Nancy.
How
Always
you
a pleasure. Very well. Very well. Thank you.
All right. Joining him today is Dr. Chikwe Ihekweazu. He's the curator, Nigeria Health Watch. Yeah. Welcome to the program, Doctor.
Thanks, Nancy. It's great to be on your show.
Thank you very much. I think I'll start first with the polls that was released this week. That was this week's poll by NOI with EpiAfric in conjunction with EpiAfric, showing that
EpiAfric.
EpiAfric. Yeah.
Yes.
That said Nigerians show high awareness of the Lassa fever virus disease and expressing confidence in capacity of local hospitals to tackle the issue. Can you just give me a brief background of the poll?
Okay, thanks, Nancy. You know, this is one of those polls we conduct trying to feel the pulse of the nation on various issues. And of course, as you know, Lassa fever has become a heart-burning issue in our media space the last few months now. So we thought we should conduct a poll on Lassa fever to understand how aware are Nigerians? Do they understand the mode of transmission? Are they confident in our health systems? And if they find out they have certain symptoms, would they be willing to visit the hospital? So interestingly, the findings show that 81% of Nigerians are currently aware of the recent Lassa fever virus disease. Not just that 81% are aware, the main sort of channels, or from where they get their information, 46% through the television, 39% through radio, and of course 25% from word of mouth and 13% from social media. So social media is playing a big part in that whole dissemination program.
So that means the print media is not even involved in the dissemination
print media is involved. Print media actually 12%. But
okay.
I mean, we've been conducting a series of polls in the last few years, and we've shown that social media has grown astronomically from 2005, where only about 2% of Nigerians receive information from social media. 10 years after 2015, 20% of Nigerians currently receive information via social media.
So Nigerians have shown great awareness or high awareness of the Lassa fever virus disease. Let me come to Dr. Chikwe. What is Lassa fever, actually? What comes to mind is rats, of course. That is, but give us a brief background.
So Lassa fever is caused by the Lassa fever virus.
Yeah.
And it's a part of a group of viruses that in specific cases cause, so the full name is Lassa hemorrhagic fever, which means bleeding from various parts of your body. But that's a rare presentation and an extreme presentation. The truth is actually most patients would present just like severe malaria or actually severe influenza. So in most cases, you can't actually differentiate it clinically from most of the common infections that cause fever in our environment. A few cases would then go on to having severe symptoms and death. I mean, one unique thing in this specific outbreak is that we actually have a higher death rate than you would normally associate with Lassa fever. So we're seeing a higher mortality rate among patients that have been diagnosed with Lassa fever than we would expect in an outbreak. So something to be worried about.
Why is there a higher mortality rate? Why? Because I noticed it also that more Nigerians have died from Lassa fever than Ebola virus disease that was. So, the awareness last year was just unprecedented, but more people have died from Lassa. But what comes to my mind is that we have rats everywhere in Nigeria, so to speak. So is that one of the reasons? Yeah,
no, well, there are two separate, two separate issues here. First is the number of people that die from the infection. So not the total number, because we've had more cases, we expect to have more deaths. But in proportion, of deaths among those that have had the disease, we have had a lot more. One possible reason for that is that Ebola was, firstly, there were a few cases, and secondly, they were managed within specialized centers that were set up specifically for that purpose. There were only 2 across Nigeria that were actually functional in the end, in Lagos and in Port Harcourt. And there were a lot of resources thrown at those centers. But now we have a situation where we have Lassa in 29 states in Nigeria. Many of those physicians managing those patients have never come across a case of Lassa fever. It's normally, even though it's been with us, it's a very rare disease. So many doctors could practice the entire career.
But isn't it surprising, because Lassa has been on, I think, since 1969.
Yep.
From, I think, a town in Borno State called Lassa.
Yeah.
So the title, the name of the virus came from Lassa, as it were. So why is it that what has been with us for a long time have not been able to be managed? Or is it because the awareness too was not that much?
Yeah. So it's a very good question. It's been with us, but Lassa is not it's not something that occurs that frequently. What happens is it's endemic in rats, and once in a while, so the rats are the natural host. Once in a while, it jumps from rats to humans. And that's why it's called a zoonotic infection. It jumps from rats to humans, either causing sporadic cases or causing outbreaks in specific geographical areas. This is actually very surprising and very worrying, the widespread nature of this outbreak, across 29 states in Nigeria at the moment. So actually, it is unlikely that the predominant narrative around this outbreak of transmission from rats to humans is actually what is driving the outbreak. I think that the predominant narrative is transmission from person to person, i.e., someone gets infected, firstly, by a rat, but subsequently, that patient spreads that infection to primarily his family, who are caring for him, and secondly, healthcare workers that are caring for them. And so, that's something to worry about.
So what's the human-to-human infection like? Because the rat now transmits the virus, but the human-to-human, is it through blood, through saliva, what? How?
Yeah, it's actually surprisingly very similar to the Ebola virus. It's just that it's a little bit less virulent, so the chances of getting Ebola from a case of Ebola are a lot higher. The Ebola virus is a lot more virulent. In Lassa fever, it's a little less virulent, so your chances are a little bit less. But it's exactly the same thing. It's fluids, body fluids, blood, and that's why healthcare workers and family members are the most at risk. In fact, if you notice, most of the cases that have been reported recently, you would find out that quite a few of them were in doctors managing patients that had Lassa fever. In fact, the recent cluster talked about a father, a husband, and a wife both getting ill. I mean, both of them were not infected by rats simultaneously. One was infected, and he or she infected the other.
Now, let me come to Dr. Bell. The level of awareness in Nigeria about Lassa fever is quite high from your poll, but it seems that a lot of people have died despite the awareness as against Ebola virus disease. I hope I'm making sense. I think I am.
That's right.
You know, so because if you're aware about something, you should be more careful, isn't it? So
I think this can be tied to the confidence also. In this poll, at least 7 in 10 Nigerians said they are confident in the ability and the capacity of our local public health centers and hospitals to be able to manage incidents of Lassa fever. In the case of Ebola, we also conducted some polls with EpiAfric on the Ebola virus disease, and only about 3 in 10 Nigerians were confident in the ability of the public health system to manage the situation. So here we are seeing a virus which has taken apparently more lives than Ebola, but here the confidence level is 7 in 10 Nigerians versus 3 in 10 Nigerians. So that confidence level also plays out here. And I think 2 reasons from our discussion with Chikwe why this confidence seems high is because on one hand, Nigerians have seen how the Ebola situation was managed and curbed. On the second hand also, there seems to be a new government. We're in a season of change, and there seems to be some level of confidence that this government has everything under control. So
that was why Nigerians actually expressed a lot of confidence that this could be curbed.
Absolutely.
But the question now for you, Dr. Chikwe, is, apart from the poll, is there really that confidence that our local hospitals can actually curb this? Because if our local hospitals could curb or can curb Lassa fever, as it were, we should have more attention. Perhaps even medical experts shouldn't die the way they are dying. There should be more awareness in terms of not just being aware, but in terms of the facilities are there and I know what to do as a health official and even as a Nigerian or even the victim, as it were. I hope I'm making sense.
Now, so you're making absolute sense. Absolute sense. In fact, you know, you could almost take over our roles.
I shouldn't tell you what I studied anyway.
In public health. No,
yeah.
You know, you're absolutely right. There's a lot of general awareness about Lassa fever and the association with rats. But what is missing? Like I said, not many health professionals are actually exposed to Lassa in their career. So what is missing is the specialist information directed at healthcare workers in terms of what to do when you have a patient that is potentially infected by Lassa fever. So that information is not easily accessible. So if you have a doctor somewhere in Ebonyi State or in Nasarawa or in Jigawa that suddenly sees a patient with Lassa, I'm not sure he would know what to do. And secondly, where they would normally get that information from would be the National Center for Disease Control. That is the source of information. That should be the source of information. If this center was fully functioning for Nigeria, now this center will be doing routine surveillance for infectious diseases, will be able to do the specialist diagnosis necessary, and even be able to do things like molecular analysis, seeing whether the virus has evolved or not. So I think in terms of really protecting Nigeria for ourselves, so it's a concept called health security. You know, we need a functional National Center for Disease Control that will take on this expert role. You know, general awareness is great, but it's not enough. We need specialist awareness among those needed to manage it. You know, just like, you know, we all know the police is out there, but the issue is if we have difficult cases, can we have a specialist CID force that can investigate difficult cases? It's the same thing with Lassa. You need a group of specialists whose job and responsibility it is to do this. And they normally are situated within the National Center for Disease Control.
Okay, the National Center for Disease Control, are you saying they should have like a specialist or dealing with like Lassa fever, or perhaps most of the pandemics that actually come out? Because it seems 1 year, one pandemic or so. Now, that's the trend.
You're absolutely right. And you're right. And the thing is, we do have one in its infancy, but it hasn't been enabled and empowered to perform this function. And there's still various schools of thought of whether some of these functions should be in the ministry or in an NCDC. And in the meantime, nobody's really leading the response. And the government keeps setting up new committees. So a new committee was set up to lead the response to this outbreak. And that's really not the way to do this. You need that specialist expertise that does this 24/7, the experts in this, and they can always respond. And the minister doesn't need to form a new committee. You know, the formation of committees really shows a lack of confidence in the institutions that are responsible for dealing with this outbreak.
Is it just a lack of confidence or perhaps a lack of preparation also?
Yeah, I think that's a question that you'll have to throw at
our
leaders when you have them. Absolutely.
Okay, Dr. Bell, the NOI polls, of course, in partnership with EpiAfric, the opinion poll was to assess the perception of Nigerians on their awareness. Did it also take into cognizance that Nigerians showing great awareness, did they know the mode of transmission, the symptoms, for example, and all of that?
Absolutely,
okay,
absolutely.
Okay.
I think something interesting we found in this is that the awareness also matched with their knowledge about the mode of transmission. So at least 93% of Nigerians said that we know that the Lassa fever virus is transmitted through rat-infested food. But then again, we got some 10% of Nigerians who thought that bushmeat could be a major cause of Lassa fever. But there you have it. That's their opinion, and that's what they think.
There's a part in Nigeria that enjoy rats as delicacies. I don't know, but there's a state in Nigeria that
exactly, and that's why you have that sort of.
And when you go and
not just
they
one
really
state,
like you, they cook rats.
there are a number of regions, number of states, or number of communities where rat is a delicacy. So, and for them, that's bushmeat. So we have those who think that bushmeat is playing a major role in the spread of Lassa fever.
Doctor, you want to come in here?
Yeah, no, I agree. I think the major message out there is on rats, and Nigerians have really taken on that message. But I keep saying rats are not the full story. The other very important factor, like we mentioned, was person-to-person transmission. How do you stop that? You stop that with using, when you go to a hospital, insisting that your doctor uses what we call PPE, personal protective equipment, which basically means gloves and masks and gowns as they need to. So there's not enough messaging on that aspect out there. You know, there's been an overemphasis on rats. And yes, you know, rats shouldn't be in our homes, they shouldn't be infecting our foodstuff. But I think in parallel, I was surprised at the relatively low awareness on the role of person-to-person transmission, which can be stopped by, you know, simple measures, like wearing gloves and insisting. So the responsibility is both on doctors to do that, but also on patients to insist that when they go to see a nurse or a doctor, insist that they're wearing those things. They're there to protect you, and you have a right to insist.
Dr. Chikwe, I'll stick with him a bit. So Dr. Bell just, you know, I'll stick with Dr. Chikwe a bit. Every year there seems to be a pandemic or the other. Why is this happening? Because even in my own little corner, when I had to like look at why is there a rise in outbreaks, perhaps some of the reasons I could come up with were perhaps we are now getting overpopulated, climate change, even as we're talking of Lassa fever now, the weather conditions and all of that will make rats come out more than the others. You may put me right if I'm mistaken. And then I also looked at perhaps increased travel. For example, now the issue of Zika, which we'll come back to a bit later. Zika now is in the United States. The person traveled to Venezuela and sexually transmitted it to his or her partner. I don't know if he's a woman or. So why are we having a rise in outbreaks year in, year out? We seem to be hearing one of those. At the World Economic Forum, I think Bill Gates also chaired one of the sessions, or he was in one of the sessions looking at pandemics. Why? Yeah. Is the world coming to an end? Just like one of my cameraman here said before you came, it's like the world is coming to an end. He spoke it in Yoruba. You know? So what's really happening?
So that's, you've actually noticed a very important trend. That is absolutely true. There have been lots of what we call emerging infections in the last 20, 30 years. You have to remember, HIV wasn't with us 40, 50 years ago. Yeah. And now, you know, a large part of the world's population is infected. So you're absolutely right. And there's no simple explanation for this, but it's a combination of all the factors you mentioned. The ecological reasons for that, the environmental reasons, climate change is probably a big driver. And, you know, our population, the fact that travel is so much easier now than it was in the time of our parents and their parents. So, but the other thing is, actually, we have to realize that these pathogens are actually much, much cleverer than us humans in their in their evolution. And the earlier we accept that, the better it will be for us to start devising strategies to combat them. But there are so many viruses out there living, especially in the animal world. Occasionally there will be, if you think about SARS, even HIV, Lassa, potentially Ebola, they're all viruses that are normally live in the animal and
they live well with it.
They live perfectly, and they have evolved into a symbiotic relationship. And once in a while there's a jump to humans and you have a new outbreak type spreading. So that just goes to re-emphasize the point I made, that the earlier we start developing and maintaining the institutional capacity to deal with this, and a lot of this is not rocket science, and many countries have done this, you know. So I think we got carried away a little bit, Nancy, if I might add something here, in the Ebola response. So we got carried away in the euphoria of, you know, Nigeria defeated Ebola, and we're all celebrating and patting ourselves on the back, without actually sitting back and thinking, what do we now need to do to prepare ourselves for the next one? And hopefully we will do that with this Lassa fever outbreak. If we don't, we'll be faced with exactly the same conversation we're having now. Are you seeing
that we're doing that right now? Because it seems that, should we pay more attention to even the prevention versus the outbreak? Because I think the cost of an outbreak is more than even the prevention side at the end of the day. And I'm looking at how empowered is the Ministry of Health right now. I'm not even seeing media hype, so to speak, about, or media awareness about Lassa fever, except for few programs or few adverts run by television stations, you know,
and radio stations.
Yes, and we reach out to them. If we don't even reach out to them, they can't even come say, okay, Nancy, please, can you even create a 10-minute space for me or something? So are we seeing that perhaps we should go more to prevention now? What do you think?
I think, and that goes to show the great work that NOIPolls is doing as well in doing polls like this. The challenge is, you know, even among Nigerians, health is not high up on our agenda, on our list of items that we take seriously.
You say God is our insurance.
you know, but if you ask Nigerians what their problems are, we will list
money number one.
Infrastructure,
let me get
finances,
money.
roads. You know, no one will mention health because we all think we're healthy until we lose it.
That's right. That's right.
So, you know, there are two things. Yes, you know, you rarely find a Nigerian president addressing health in any of his budget speeches, in any of his speeches to the nation. You can count all the, you know, interviews the previous president had with Nigerians. You know, and health never comes up. So if we don't put pressure on our leaders on health, you know, we don't expect them to take it seriously. So we have to put pressure on our leaders. And that's why media and our partner organizations, we all have a role to play. I mean, for us, it comes naturally, it's what we do all the time. But it's up to the rest of our society to now say, listen, this is no longer a joke. You know, we've had Ebola last year, we have Lassa. Listen, there's something bigger at play here, and it's time to take this seriously.
You know, I understand that health is wealth, you know, and that's why we actually, whenever we have, I do talk about health issues sometimes, despite that. Oh, people will say, oh, it's the money show, finance just comes to your head. But they don't really know that it revolves around everything. Now, Dr. Bell, I also saw in your poll that the largest percentage of the respondents, about 63%, stated that fever is one of the symptoms of this disease. And what is actually fever? Fever could be symptoms of many diseases.
Symptoms of malaria, symptoms of
So they say fever, I have fever, let me just go to the pharmacy or to the chemist, buy paracetamol, and I'm done.
The simple truth is that from our polls, we've found that the average Nigerian thinks he or she is well. You know, I mean, we run something called the personal well-being, where we use 7 indicators to test well-being of Nigerians. We have observed over time, and this is over a period of 2-3 years, that 2 indicators always come in tops. One is the indicator for religion, which is always hitting 90 points plus, because you ask, what's your spiritual life? How's your religion? Every Nigerian or most Nigerians claim to be religious. The other is health. How would you rate yourself health-wise? 80% plus will always tell you, we feel we are doing well, we feel we are fine. So to a large extent, that also, you know, that also pans out into how people will sort of take a decision when they find out they're ill. They simply walk to the chemist nearby, walk to the pharmacy nearby. But I think that the challenge which Lassa fever has posed is that the symptom for malaria is also the symptom for Lassa. So you are best going to the hospital to get a proper medical checkup instead of just thinking, oh, this is usual headache, this is usual fever. Let me walk into the drugstore or pharmacy and self-medicate.
Nancy, actually, if I may comment there very briefly, I think there's a big opportunity in this, actually. You rightly pointed out both Lassa, Ebola, they all start up with a fever. And in the early stages, they can't actually be differentiated from malaria. So the big public health message there is to get tested for malaria. The good thing is there's actually a new rapid diagnostic test for malaria that takes 10 minutes to do. So rather than go and buy whatever you buy and self-medicate, get a test. So rule out malaria or rule it in. If it's malaria, then you're treated. If it's not, at least the healthcare worker, the doctor, the nurse can then start thinking of other potential illnesses and start testing for them or arrange for you to be tested. But the longer you're treating yourself for what you think is malaria and is not, the more you're putting yourself and your population at risk. So a big message out there. In fact, if I was the government, this is the message I would be driving. It's not malaria unless you test for it. Not every fever is malaria.
That's right.
Get tested for malaria. Treat it if it's malaria. If it's not, then let's start looking for the other causes.
I think this is one vital thing you said, which I'm also taking away. Not all fevers, the symptom of malaria, isn't it? So just test first for malaria, because you get, what's wrong with it? It's like I'm having small malaria, you know, headache and all of that. It's not.
You can't make that diagnosis clinically. It doesn't matter how good the doctor is. If a doctor looks at you and feels, examines you physically and tells you you have malaria, please tell him, no, sir, it is not possible for you to make a diagnosis of malaria by just examining me. It is not, especially in this context. So also, Nigerians need to challenge their physicians to do the right thing. The right thing is to get tested.
Okay, Dr. Bell, your survey showed that most Nigerians are aware of the Lassa fever disease, Lassa fever, then acknowledging that the Ministry of Health is carrying out adequate sensitization.
Yes, indeed, to a large extent. And when you look at the level of awareness and the trend at which they are getting the information. So TV 46%, radio 39%, word of mouth 25%, and social media 13%. So if you don't get it via TV, you are bound to hear it on radio. I mean, I've listened to a few radio programs now, a few radio stations, and I found out that some of the radio stations have crafted jingles on their own, and they are pushing those jingles out. So that's something good. On the one hand, it could be the efforts of the Ministry of Health. Also, it could be the efforts of private media organizations just trying to do their own sort of public good to push out the information and get more people aware. But for us, is that interest to see that how social media has grown over time, and the opportunity for even the Ministry of Health to cash in and use social media to do a lot of dissemination work. I don't know who manages the, say, Twitter handle of the Ministry of Health, but there is huge responsibility that should come with managing such a handle, because it should be a veritable channel to pushing out quite a lot of the information that people need at this time and age. By the time you get several retweets and retweets and retweets and on Facebook and all that, you find out the information goes out farther than maybe trying to hold a press conference.
You know, in our own little research as the show, we found out that rat poisons and rat traps, all the prices have gone up. In fact, asking one of the rat poison seller, he said, oh, thank God, the market don't go. Market is good now. And I'm asking, yes, it said that the business is really bright now. And I'm asking, okay, the outbreak of a disease means that business is good. The outbreak of Lassa means that business is good for a rat poison or a rat trap seller. But you can see one good for the other. The other
absolutely. I mean that's it's a way of life. You know, you ask the coffin seller, he tells you business has not been so good. We're hoping business can get better. And you know what that means. So I'm not surprised to see that you know, those sellers of rat traps or tapioca, as the case may be, are having a field day. It's that's Nigeria.
Nancy, I think another point, though, you know, this is the money show, and so is to look at it on the other. You know, if this outbreak gets out of hand and it grows, can you imagine the economic consequences? You know, people will stop coming to Nigeria. You know, next thing you hear, BA might stop flying, and you know, so the economy can literally crash to a halt if we don't take proactive measures against this. In
fact, there are some airlines abroad that have stopped going to South America, or have even discouraged their flight attendants that are pregnant not to go to
and consular offices. And there are quite a lot of consular offices that you go on their website, you find information, Lassa fever outbreak in Nigeria. Either you don't go or be careful when you are in Nigeria. So you get that sort of information because they do their homework, they do their checks, and they put that information out there to benefit their citizens.
Okay, Dr. Chikwe, let me also ask you the financing option, especially for surveillance. And I will also want you to answer the issue of even the Zika virus. We are looking at it now that, oh, it's abroad, but it may just come closer home. And the WHO has declared it as a global health emergency. What are the financing options, and also should we be careful of some of these outbreaks?
So there are two questions here. In terms of the financing options, you know, if we had a Center for Disease Control in which the population was confident in and our government was focusing in, you know, it would be in everyone's best interest to fund it. And that organization would then have the capacity to advise and do the research on all these new outbreaks and continuously update government. In terms of the outbreak in South America and Latin America generally, the new Zika virus, I think the point has been made in terms of the potential economic harm it will cause. But the truth is, with a new virus like that, so the Zika virus as well has been around. In fact, over 90%, in fact, over 99% of all cases of Zika virus cause a mild febrile illness. So this connection, that actually if you read the wordings carefully of the WHO's announcement, the public health event of international consequence is not actually on Zika virus. It's on a cluster of microcephaly, so children with small heads that may be linked to Zika virus. So that link is not proven yet. But as a preventive measure, they've declared this a public health emergency. Now, the biggest priority for the WHO now and all the other countries is to prove that link or disprove it. So the truth is, for now, there's no good test for the Zika virus. It stays in blood only for a few hours, so to test for it is very difficult. The advice about pregnant women not traveling to South America is neither here nor there, because, you know, research shows that 50% of women don't know they're pregnant in the first couple of months of pregnancy. So there's a lot of work that needs to be done, and that work can't be done by jingles and big declarations. They're actually very diligent work that needs to be done by experts, and it's happening now across the world. But we must contribute to that, because we have a large population in Nigeria. We travel a lot. So, you know, if there's any country at significant risk of these viruses, it's Nigeria.
I'm really, you know, really concerned. You know, when I heard about the Zika and outbreak, I was like, oh, Nigerians are very good travelers, you know, that we need to also be very careful. But doctor, why is it that most of these viruses, or some of them, have origin in Africa? Ebola here, even the Zika now, I think somewhere in Uganda, called Zika. And I was like, why is it everything here is in Africa? Why?
Well, not everything. You know,
some of this is on the portrait that is really African.
No, the truth is, some of them were first described in Africa. I mean, SARS didn't originate from Africa.
From Africa,
it was from the Far East. So, I mean, there are many varied explanations to this, but the truth is, in many African societies, we still live ecologically very close to animals and very close to wild forest environments, where it's easier for these viruses to jump over from an animal host to a human host. And that's just a factor of our evolutionary cycle. And the closer we live to animals like this, the more likely that the more likely a virus can jump from an animal host to human. Okay. So that's just the way it is. But I don't worry too much about the emphasis of where it's coming from.
Yeah.
It's really what do we do about it.
Yeah. Okay.
Something interesting happened while we were conducting this poll. We found out that quite a number of people, especially from the northeast and particularly in Borno State, were not happy with the name Lassa fever. Yeah. So we found people who said it's giving our area a bad name. It's causing some stigma to this area. So please, in fact, some of them saying, can you advise the World Health Organization, can they change the name from Lassa? Because actually, locally, there is a name they call it. Yeah. They don't call it Lassa fever. So they were calling it certain local names. And, you know, they say it's giving our area stigma. Can you advise, can you help us pass our information across to WHO and tell them we don't like this name? Ebola, for example, is the name of a river. Yeah. So you get these names being attached to the place where the virus was first discovered or where you know, it was tested. But what's for us key as pollsters is the fact that people associate a name to a place. And this place, while all over the world people may see it as just a name, to certain people who come from that name, it's very, very important. It's a big problem for them.
You know, I would ask the doctor, okay, let me ask you, what kind of response should we have, especially towards outbreaks? I know you've said it somehow, but I want you to emphasize on that, because, for example, I asked myself, how many of us still wash our hands? You know, when the Ebola outbreak was there, any small thing, you wash your hand or you use your sanitizers. The hygiene methods now are gone. So it's like when there's an outbreak, we just panic. We ask ourselves, how can this be? Perhaps we scrabble to create new drugs for those in the pharmacy section and all of that. So just quickly answer it. And after you answer, in a few seconds, I'll just take it. Tweets coming in because they are really jamming my phone.
Good, I like the interest. But you're absolutely right. And, you know, there are many, not just for this, I think it's time to re-emphasize all the preventive approaches we have. It's the washing of hands, it's the sleeping under bed nets for children to prevent malaria, it's the avoiding HIV infection by abstaining if you can, or by using a condom if you can't. And all these public health messages, so that we don't have silver bullets, sadly, in public health. And a lot of these are behavioral change issues that are sometimes difficult, because we can't wash our hands once in a while. We have to get used to doing it all the time. We can't have our children sleep on the bed nets 1 day in 7 or 3 days out of 7. So these are really lifestyle changes that we have the opportunity to now implement. But like all of these things, it needs constant reinforcing by healthcare professionals, by all of us working in the space. And media, absolutely. One fascinating report I found here is, Belle, you've been absolutely right in terms of the growth of social media. But close to 50% of the audience still get their information from TV. Television. So you have a big role to play, Nancy, and your colleagues.
Absolutely.
Okay, let's take a few comments coming through. Economic Punk says, pandemics may discourage FDI. FDI is foreign direct investment. Tourism affect manpower productivity. Adebisi says, I remember those days, rats are much more than now, and we never experienced such disease. I think we have to go back to God, the religious factor you mentioned. Samuel Dan says, is there not a vaccine for Lassa fever and Zika virus? I don't think there is. Is there a vaccine?
No. Sadly, there's no vaccine.
No yet. Okay. Aloysius says, please, what factors are responsible for bleeding with patients suffering from Lassa fever? It's called Lassa hemorrhagic fever. So hemorrhagic, you bleed. Okay, DJ says, I'm enjoying the show. One thing I believe is the world is coming to its end with all these viruses. Let's just be careful.
There you go.
There you go. Nigerians are very religious people. Okay, Corey says, when Pharaoh disobeyed God, Egypt suffered 10 plagues. The world is disobeying God. And these 5 plagues are rampant. May God help us. Okay, Osarity says, hello, Nancy. Thanks for this important topic. I think the Nigerian government at all levels should be proactive. Niger Braided says, social media and the internet in general has about 30% awareness of Lassa fever. Okay, a lot coming in, a lot. I still have, okay, just a few seconds, Director, so that we can actually take a few more comments. Okay, this is coming in from Real One. Professor Johan van Dongen of New Zealand, a medical scientist, has written a lot of these conspiracies. Okay, those are the tweets I can take. I just want to say many thanks. It's like this show is not even enough for this kind of dissemination of information, but many thanks for coming, Dr. Bell, again. Dr. Bell Ihua is the Chief Executive Officer at NOIPolls Limited, and Dr. Chikwe Ihekweazu is the Curator of Nigeria Health Watch. A first time on the show, and perhaps this will not be the last. Thank you very much, gentlemen, for coming on the program today. All right, this is the much we can take, and I think an incisive one, an educative one at that. Everything they have said here, please, let's put it to heart. Don't forget to wash your hands, use your sanitizers, use the bed nets and all of that. Health is wealth. That's why we're looking at it on today's edition of the program. Please join us again Monday, same time. We'll be here with another topic. Have a fantastic day, everyone. And don't forget, be the best you can be the change you want to see. I am Nancy Illoh. God bless Nigeria. Bye now.